Hi, we're here with Dr. Alyson Shaw, early literacy champion and author of the new CPS statement, Read, Speak, Sing, promoting early literacy in the healthcare setting. Thanks for joining us, Dr. Shaw.
Thank you for having me. It's nice to speak with you today.
Dr. Shaw, why is literacy a pediatrics issue at its core?
Well, learning to read really starts from birth. In those first few years of a child's life, that's a time of really rapid brain development. And babies need to hear lots of words and lots of language even before they learn to speak to help build those neural networks and to support future learning. They need to be surrounded by words and language so that when they're ready to go to school, they're ready to learn to read and write and succeed in school. Typically, children spend the first few years of school learning to read, and they spend the rest of their lives reading to learn. So it's really important that we set them up for success.
Wonderful. And so which families should be targeted for counseling on early literacy?
We know that families want to have advice from their healthcare providers about child development and learning, and they want to feel like valued partners in their child's learning. So really all families can benefit from advice on early literacy, but the type of advice and the suggestions that we make can be tailored to an individual family's situation. For example, some families may not know that they can look at books and read with their children before they can talk, or they may not feel comfortable themselves with their reading, with reading themselves or their previous reading experiences. So they need to know that there's other ways to help their child develop language and a love of learning besides reading books. They need to know that telling stories and singing songs together are other ways to surround their child with language, and that it doesn't matter which language or way they choose as long as they're having fun together with their child.
And so for your colleagues, can you give us a couple examples of how this guidance would be incorporated into a typical well baby checkup?
I guess what I would want people to know is that providing guidance about literacy doesn't have to take up a lot of extra time. It can be as simple as asking families if they've had a chance to start looking at books with their baby. And that can be, as simple as incorporating that into your conversations about other routines like sleeping and mealtime.
This brings me to my next question. This new iteration of Read, Speak, Sing definitely has a greater emphasis on singing and storytelling than the previous version. So can you tell us a little bit about why that was?
Well, in this updated version, we wanted to emphasize that not all literacy activities need to involve books. Yes, books are a great tool for facilitating language between parent and child, but singing and storytelling are too. Some cultures have a very vibrant tradition of storytelling, and that's important to remember for our families. Because of the repetition and the musical phrases, singing songs can make words and rhymes come alive as well